I'm very happy to introduce Dr. McClanahan. I'm thrilled that she agreed to speak with us today. I'm an admirer of hers from afar, reading many of her articles and seeing many of her presentations. Dr. McClanahan is a physician turned financial planner. In addition to working in her financial planning practice, Dr. McClanahan speaks regularly on the interplay between health and financial issues, particularly healthcare costs, healthcare reform, chronic illness, and end-of-life planning. She writes for various publications and serves on the CNBC Financial Advisor Council. She has appeared on CNBC, AC 360, Hardball, and Morning Joe. She's quoted regularly in multiple publications, including the Washington Post, New York Times, and NPR. And with that, Carolyn, thank you for speaking with us.
Thank you so much for having me. The good thing about Zoom is we can now go anywhere and talk to anybody. So it's an honor to speak with you. I'm actually in Jacksonville, Florida, North Florida. So which quite all right, Kristen. It's like Florida's a big place and people get it confused. So I live in a swing county that's very hot right now, and healthcare is the big hot topic. So it is indeed crazy. What I want to do for you guys today is I talk very fast. So my parents are originally from New Jersey, so I'm not a traditional Southerner. And so I think that the people in your state talk fast too, so you'll be able to keep up. And you're going to have a copy of that. Well, you guys are recording this, but I'm also happy to send my slides to you. This talk I like to do is a lot longer than you guys want to sit here and listen to. And so I'm going to cover the high points, but share all of the slides with you. So if you want to reference the slides to learn a little bit more, you're welcome to do that. I'm going to take questions at the end, leave a few minutes there, and then we'll go from there. So let me go ahead and share my screen. And I'm going to start the slideshow. So you guys are seeing the slideshow view now, right? Good. Okay, great. So I call this the continuing soap opera of healthcare reform because that's basically what it's been. I have been a health policy student, gosh, for greater than 20 years now. I started my career as a physician. I became a financial planner I went back to school in 2000. But I've always kept up my license in health in medicine. I'm a primary care physician, family medicine board certified, and practiced emergency medicine. And I have basically volunteered in the public health sector since 2005. So I still practice as a physician, more as a volunteer, and I'm a financial planner. And I recognize all these areas where financial planners could be better if they understood a little bit more about healthcare. And then when the Affordable Care Act passed, and I had already done a talk before the Affordable Care Act on how to help uninsurable people get health insurance. And that was very popular. I speak all over the country. When the Affordable Care Act passed, I read the entire law, and people thought I was crazy, but I figured somebody had to read it. And, especially in the finance field, they didn't understand it, so I put together a talk, and then I became really popular. I've spoken to hundreds of thousands of people through the past decade since the Affordable Care Act was passed, and I kept up with the healthcare reform. So I named this the soap opera of healthcare reform originally, and it's for the past 10 years it's been the continuing soap opera. So we're going to cover a brief review of the history of healthcare reform. I think it's important for people to put it in perspective so they understand it a little bit better, and then go through the cost of our healthcare system and then the current thinking on health reform. So I'll basically break down what the Republicans are doing versus what the Democrats are doing. You can't help but health reform. It's political, and so I write for Forbes, and I'm the moderate for Forbes. When there's something bad about the Affordable Care Act, I write bad. When there's something good about the Affordable Care Act, I write good. And I get hate mail from both sides. And so when I write bad things about Republican health policy, I get hate mail from Republicans. So and when I don't write well about Medicare for all, even though there's some good stuff about that too, I get hate mail from them for A people. So So I'm the least liked person in the world because I refuse to do just partisan talking points. So just want to kind of lay that down for you, is if you get mad at me, that's not unusual. So let's do a history of health reform first. I'm going to go back to Truman. Truman tried to get health care reform together in his first years in office, but he couldn't. And the big opposition was actually the VA health system. And I like to bring that up because people talk about how bad the VA system is. When the VA system was first done, well, it was actually started long before World War II, but it got a lot of funding and great reform with World War II, and it was just a fantastic system. It was state of the art, and the veterans thought that they were going to lose their fantastic health care. And through the years, the VA system has come and gone in how well it's run and how well it's funded, and when it's funded well and run well, it does a great job. And so they opposed it. About half the country had private insurance, and they sent a bill to Congress, but they didn't figure out how to pay for it. And then the Korean War happened, but that bill that was sent to Congress became Medicare. And it's very fun when Medicare finally passed by Johnson. The number one Medicare recipient, so patient number one was Truman, and he was at the signing. So if you guys can find that picture, it's a fun picture to see him being there. So Eisenhower, he pushed private insurance, so he was a Republican, and tried to reform insurance through high-risk pools. So we hear a lot about those. High-risk pools have been tried for years and years and years, and they just don't work. Back then, 90% of single elderly and 14% of couple elderly people had insurance that covered medical expenses. So there was a lot of poverty and bad health in elderly people just because of health care. And so there was a bill passed that provided a stipend to provide private health insurance, but it helped 1% of the elderly. So it wasn't that great. But the big thing that Eisenhower did, which to me has messed us over to this day, is they created the tax exemption for workplace health insurance. And that's why insurance is tied to employment to this day. And as you've seen through the pandemic, that has created a mess. And you have millions of people losing jobs, and there's no new jobs where they can replace their health insurance. It's just not a good way to go. So one stance I have taken, I think we need to remove health insurance from employment. We just need to do that. Kennedy was interested in international affairs. They presented Medicare, but it was a really tight election, and he didn't really have legislative backing. And so it was presented, it was voted down 52-48 because they bought off a senator, and when one senator was bought off, one other went on board with that senator because they just from political reasons. So then Johnson came in, and he was the most important healthcare president ever. He's like my second favorite president. And he won in a landslide, and he had both the House and the Senate, so he had momentum. And at that point, there were three bills that were trying to be passed. One was the Democratic plan to pay hospitals, and that ended up becoming Medicare A. Another was the GOP plan to pay physicians, that became Medicare B. And then there was Medicaid, which was the American Medical Association plan to take care of the poor. And so they were all fighting to try to get their bill passed. And Johnson said, I don't give a damn what it costs. I want all three passed, and they did. And so that's why we have all of these things today. Medicare A and B were very popular. There were a lot of fights in states around Medicaid because people just have this issue about covering care for the poor. And so we saw that in the ACA too, that they fought over expanding Medicaid when Medicaid was better funded under the ACA. So Nixon, Medicare and Medicaid were underway. He wanted a comprehensive health insurance plan to cover everybody else. So that was all these uninsured people that weren't covered by Medicare and Medicaid. And so he put forth the comprehensive health insurance plan. It required all employers to provide coverage. It limited employee cost sharing. It had a generous essential benefits. And what does that sound like to you guys? You guys can't talk because you're muted, but that's basically the ACA. And this became the bones of the ACA. It also was much more generous than the ACA because it had a government-provided plan for those who were not employed. That is what would be the public option, which is what should have happened with the ACA and what Biden is proposing now. it would have passed, except Watergate happened. So we did not get comprehensive health reform. And the Nixon plan totally covered pre-existing exclusions. And that is the last Republican plan that actually does cover pre-existing exclusions. So others, Ford and Carter did nothing. Reagan, he was totally against socialized medicine. He did a bunch of cuts to Medicare when he first came in, and then he saw the fallacy of his ways. And at the end of his administration, he had the largest expansion of Medicare since Medicare had been enacted. And then Bush 1 offered tax credits for low-income individuals to buy health insurance, but they were going to finance it by taking away the tax deduction from employer-based coverage. Because everybody at that point loved their employer-based coverage, that was a political nightmare. It failed. Clinton didn't know what he was doing with health reform. Bush 2 did the second biggest expansion of Medicare with the Medicare Modernization Act, which became Medicare D, that did basically all of the drug coverage now. So the Affordable Care Act, its main goal was to provide health insurance coverage that covered everybody, rebuild our primary care system, which is part of the problem in our country today and why our healthcare costs are so high, and then add a focus of prevention and early care of chronic disease, change payment methods to rein in costs, and it wanted a public option, but we can blame Joe Lieberman for that because he sold out to the insurance companies and voted. He said he would not vote for it if it had a public option. So that is part of the problem with it today. So what went wrong? I call it death by 1,000 pinpricks. Coverage expansion took precedence over cost control. And so costs started running amok because they didn't work on cost control concurrently with coverage expansion. They made a complicated health insurance system more complicated. There was no public option. And then the lack of Medicaid expansion in states that argued against it hurt everyone in those non-expansion states. And what's really sad, Florida, we were not an expansion state, and it continues to be a problem to this day, is people blame the ACA for the woes in those states because the cost went up for everybody else because Medicaid was not expanded. And when it really was the fault of those governors who refused to expand Medicaid. Now, funding cuts for the good part of the law happened because if you remember, the House was retaken in 2010 by the Republicans, and so they had to bargain with a lot of the law, and they did not. There was a big chunk of money that was supposed to go to rebuild primary care and to fund our public health system, which actually hurts us to this day with coronavirus, and that was cut. So, and then the cost control measures never really happened. So the American Health Care Act is the Republicans' plan that they passed in the House in 2017. That provided block grants to states for Medicaid, and that's problematic because if the states have a big funding shortfall, they're not going to be able to get all the money that they need to fund Medicaid. It did not provide guaranteed risk insurance coverage. You use high-risk pools, and as we know, high-risk pools don't work. The Senate didn't pass it, so it was not signed into law. So now I want to move on a little bit to the cost of health care, because we got to keep some things in perspective here. Back in the 1970s, healthcare consumed 6.2% of the GDP. The OECD average, so that's all the industrialized nations, most of the places where you'd be happy living, the average healthcare GDP was 4.6%. As time progressed, it became, for us, a much, much larger part of GDP. 2019 at 17% of GDP. OECD average, all those other countries, their cost of healthcare is only 8.8% of GDP. And so you can see here are all the OECD countries. Some of them you wouldn't want to live, but most of them you would. And then you can see you see this nice little thing. Here is average. This is the average OECD country. Here's the United States. Isn't that crazy? We spend over 2 times, almost 3 times the average OECD country, and we don't have better health to show for it. Now let's put this in dollars per person. In 1970, we spent $327 per person on health care. Now it's over $11,000 per person on the cost of health care. The average inflation has been over 7% for the US. It's been high for other countries too. They started with much lower cost of care, so their current cost of care is much, much lower than ours. Now, let's look at it by how much the government spends on healthcare. Because people talk about how these other governments pay so much more for healthcare than the private citizens, so everybody has these high taxes. Well, in the 1970s, government paid 37.2% of healthcare costs. And you can see the OECD, it went up a lot, but it's gone up through the years. And so 1970s to 1980s is when Medicare blew unchecked. So that's where you see it go from 37 to 42. And then Reagan in this decade made the cuts, so it actually went down, but he went out the end of the 80s, so, and that's when he did the big expansion. So again, it went unchecked, so 40 to 44, and then Bush 2 made the Medicare expansion in the beginning in 2000, and so by 2010, before the Affordable Care Act came into place, we're at 48.4. And so now the Affordable Care Act has brought up the government part of healthcare to about 50%. So so if we spend $11,000 per person per year, about $5,500 paid by the government, $5,500 paid by private dollars. So, and this just kind of gives you a nice little graph. This is how much all these other countries of government money spend. So look, they spend about the same as we do, but look how much more we all have to pay out of our pocket for our healthcare. Other countries, they don't have those big dollars coming out of their pocket. So that's cost of healthcare. And are we healthier because of it? We are great at rare disease, our cancer, our accidents, but we stink at what really matters: preventive health, common chronic problems like diabetes, hypertension, obesity. And what do they do differently than we do? We spend very few dollars on primary care. They have great primary care systems, plus they choose one healthcare system, and we have 4 types of healthcare systems. So what are those? Government paid, government provided. That's what England does. That's basically our VA system and our armed services. Government paid, privately provided. That's what Canada does. That's basically Medicare, some of Medicaid. Privately paid, privately provided. Germany does that. That's our traditional insurance. And then self-pay. That's the individual pays out of pocket. Many countries have some form of this, but that's mostly what you see in third world countries. So because we choose to we don't pick one system, that makes our system more convoluted and more expensive. So the other things that they do that are good that we don't is they have single billing systems. They have a national electronic health record instead of all these crazy different health records. Germany, most of their care is not, their private insurance is nonprofit. So that makes a big difference when you have for-profit care versus nonprofit care. So are you guys learning stuff? You can shake your head yes or no. Yep, good. I'm glad some of this was useful. It opens people's eyes. So now let's move on to current health reform. I'm going to cover healthcare philosophy, status of the ACA, and the Republican Trump approach, the Biden approach, and then I'm just going to say a little bit about Medicare for all, and then we'll open it up for questions. So healthcare philosophy, the Democrats chose coverage over cost. They want to make sure everybody's covered. Republicans, it's more important to them to control costs at the expense of expanding coverage. But one thing people aren't talking about, by cost to the Republican Party, they're talking about cost to the government, not necessarily cost to the individual. So all of their things that they're proposing really is focused on trying to control how much the government is paying for healthcare, which ideally means that it would come down to tax savings for the rest of us, but that's not necessarily true. So the big problem we have in this country, as a country, and we're all responsible, is we have not agreed that universal health care is a social goal. All those other industrialized nations, they've agreed to that. And the problem is, in our country, we're about half collectivists. So these are people who believe that it's for the greater good that we at least provide a basic care for people, versus the individualists who feel like everybody's on their own and they should pull themselves by their bootstraps. And so that's why we can't come to a decision in this country about how we are going to get to universal health care, or are we ever going to get to universal health care. So we've had basically three philosophies: free market care. That's what the government, the Republicans would like. The one problem with that is healthcare, you're captive. And so free market, you have to have choice. People don't have choice when they get really sick. They just don't. You don't have time to shop. It's hard to figure things out. You cannot shop effectively when you're ill. So that's one problem with free market care. There are parts of the healthcare system that could be free market, but for the most part, you can't rely on it for everything. Then we have the Affordable Care Act, and then finally we have Medicare for All, and there's many stripes of Medicare for All that have been proposed. The problem with all of these, do any of them address the true problem, which is the underlying cost and inefficiency of our healthcare system? And so I say that, addressing only payment reform is like using using monetary policy to fix the economy when you need fiscal policy to fix the economy. So programs that give jobs, programs that rebuild infrastructure. We need to fix the underlying costs and the underlying problems with the healthcare system to control costs. We also need to fix the payer system, but we need to do it all, basically. So are we going to do top down versus bottom up? And basically, I'm sorry, I covered this slide in advance without going to it, but basically we got to fix everything. So let's talk a little bit about the status of the Affordable Care Act. The Trump administration has continually undermined it, and they reduced the open enrollment period. They cut the budget for advertising and navigators. They did not pay insurers for cost-sharing subsidies. This is a major reason that the cost of premiums have gone up so significantly in the past few years. And this was recently ruled illegal by the Supreme Court. But already there were nonprofit insurers that we were hoping would provide competition to the for-profit ones. And because they refused to pay those cost-sharing subsidies, all the nonprofits except one went out of business, the nonprofit insurers. So now all we have left are pretty much the for-profit insurers. They undermined protections to the ACA. They supported work requirements for Medicaid. And study after study shows work requirements do not work for Medicaid. And they, of course, support all lawsuits that invalidate the ACA. So there's a big case. You guys are probably hearing it now. And this is why the replacement of Ruth Bader Ginsburg is such a huge deal. Is there is a case that's going to be heard November 10th, so right after the election, that challenges the entire legality of the ACA. And most likely, and it's because, I won't get into the details because it's a little complicated, but most likely the court will invalidate the individual mandate, which gets rid of pre-existing condition protection, but they may keep the rest of the ACA intact. But there is a chance that they'll just throw out the whole ACA, and the ACA is much, much more than just health insurance. So that would be a travesty if that happens. Now, so what's the Trump Republican approach to healthcare? Trump has always promised that he is going to release a healthcare plan. He's said it 4 times, and he's always said, I'm going to release it in 2 weeks. And it's in health policy circles, it becomes a big joke. As soon as he says that, we put a date on the calendar and we all start tweeting about, it's 2 weeks, where's the health plan? And he promises to protect pre-existing conditions, but there's no plan that's materialized. He has done many, many executive orders, which I'll cover. The problem with executive orders is they are aspirational. You have to have federal guidelines written around them, and then people have a chance to challenge those guidelines. And so nothing that he's really done around this has materialized. So executive orders, especially, he's had this big glut of executive orders since July, and I think most people see that that's a re-election bid issue. So what's it take to protect pre-existing conditions? Because Every politician says, I'm going to protect pre-existing conditions. You have three things you have to meet to protect pre-existing conditions. Is there medical underwriting, or is there a proxy they're looking at to have some sort of underwriting? Is that being done to price the policy? If that's so, that is not protecting pre-existing conditions. Are they guaranteeing issuance of insurance, meaning no matter what? So that means they have to issue the policy no matter what type of problems you have. And will the policy cover essential benefits? It doesn't do any good to be able to buy a policy that excludes cancer. And so a lot of what they, and let's say you get cancer, that's going to be worthless to you. And is the policy going to be affordable for everybody? So everything that has been done so far, so the ACA has no medical underwriting, and policies are based on location, age, and in some states tobacco use. So it meets all the things that are required to protect pre-existing conditions, except cost has become unaffordable. But that's where the premium assistance has come into play. That was supposed to help with that, and that's one of the things Biden wants to fix. So the ACA so far is the best thing to protect pre-existing conditions out there. The Republicans have historically offered guaranteed issue, meaning the insurance companies have to sell you insurance, but they allow medical underwriting. So there was a study done by the Center for American Progress on the American Healthcare Plan, and it showed that if somebody has non-metastatic cancer, they would pay $28,000 extra per year for their health insurance. Not affordable. Uncomplicated diabetes, $5,600, depression, $8,400 extra compared to the normal premium. So that is not protecting pre-existing conditions. And the current plans that are actually being released by Republicans now either have some sort of proxy for medical underwriting, or they say, or they're going to use high-risk pools, which do not work, or it will allow the insurance companies to exclude coverage of certain conditions, expensive conditions. So there's nothing out there that they're providing right now that truly protects pre-existing conditions. So I'll go through some of Trump's executive orders. He expanded health reimbursement arrangements so people could buy individual health insurance. The insurers are still trying to figure this out. He expanded association health plans and short-term insurance, but none of these provide coverage for pre-existing conditions, and you have to undergo medical underwriting, so you can be turned down. And what these plans do, though, is they take away the healthy people from the regular insurance, making the regular insurance more expensive for people who are sick. So for insurance to work, it has to have a large pool of both healthy and sick people. And so this is one of the things that's being done to kill the ACA. And in fact, you'll go to health insurance salespeople's sites and you'll see, oh, look at these short-term plans, they're great. And in fact, I had a client that was being offered one of these, and she's 28-year-old trying to get pregnant. They didn't tell her didn't have pregnancy coverage. I mean, the agent didn't tell her. He just said, oh, this is a great plan for you. And so I said, you cannot buy that plan because it will not cover your pregnancy. And so his next one created price transparency. Price transparency is fantastic. And I think that's a bipartisan thing. Everybody wants it except the health insurers and the healthcare providers, because they don't want to tell you how much they're charging. They want to be able to be as sneaky as possible so they can charge you as much as possible. Plus, consumers don't like to shop. So I think it's good to have transparency, but that really is not going to fix the problem. They had an executive order to provide insulin and epinephrine at deep discounts, and they announced this really big, but they didn't tell you that that was only going to affect people who are patients at community health centers, and which is 25 million people. But what about the other 300 million people that might need to buy these drugs? So it sounds great, pretty worthless though. He wants to increase drug importation to lower prices. This sounds great too, but Canada doesn't want us to do it. They don't have enough drugs to send us all the drugs we need. we need to be able to negotiate directly with drug companies through Medicare to reduce drug prices. That just needs to happen, and nobody's doing that yet, but it needs to happen. So July, now we're getting close to the election. He did a bunch of executive orders in July, trying to lower drug prices by targeting pharmacy benefit managers. This gets pretty complicated. This would reduce how much the government is paying for insurance for drug costs, but it actually will raise Medicare D premiums for beneficiaries, so that's not a good thing either. This is a good executive order, improves rural health and telehealth access. I think the coronavirus showed that telehealth is a good thing, and this is something that's needed to happen for a long time. So it doesn't go far enough, though, on the rural health, just so you know. Then that he just released one, he's struggling in the polls. It's a very vague executive order that talks about how well he's done controlling healthcare costs and drug costs, and it provides vague direction to HHS to provide better care and lower the costs. So, but there's no detail in it at all, so not useful. So let's go real quick through Biden's health policy, and then I'll have about 5 minutes for questions. He wants to add a public option for the Affordable Care Act, way overdue. The big thing we have to watch out for is that, so it's going to have lower premiums, but are all doctors going to be required to take it? Because if it doesn't pay enough and doctors don't have to take it, it's not going to be that great. Now, will it be privately run like Medicare Advantage? And a lot of, in some areas, Medicare Advantage is a good thing, but the overhead for traditional Medicare is only 3%. The overhead for Medicare Advantage is 20%. And so this is, makes me mad, because this is Medicare people's healthcare dollars. 20% is going to the insurance company, and that's not good. So one of the things you'll see from me, if Biden is elected and they actually go through all this, people like me are going to be screaming about, let's make that public option a good public option so that it really works. He wants to provide more generous premium tax credits. So these are going to be based on a gold plan instead of a silver. And he's going to eliminate that 400% poverty level cap. So what happens, if you're at the 400% poverty level for a single person is $50,000. And so if you make $1 over $50,000, then you lose your entire tax credit. And for somebody who's in their 60s and paying $10,000, they get a $10,000 credit towards their health insurance, to lose their tax credit is huge. So what it would do is it would limit your premiums to no more than 8.5% of your income, and then you would get a tax credit for the rest, no matter how much it costs. He's going to crack down on surprise billing, overdue. Everybody's been talking about that forever. And basically the insurance companies and the providers argue about how that's going to be done. So we'll see if they can actually get something passed. It has not been able to be fixed yet. He wants to negotiate drug pricing for Medicare, allow purchases from foreign countries, cap drug prices based on inflation, increase generic drug competition, and eliminate tax breaks on drug advertising. I would love to see this. Only our country and New Zealand allow drug advertising, and it really increases the cost of drugs. In fact, pharmaceutical companies pay way more to do advertising than they do for research. So they just spend a fraction of the dollars on research. Most of it's on advertising and profit. So and this is, to me, so important. He wants to increase funding for public health, community health, telehealth, and rural health. And we are overdue. I think you guys learned from coronavirus, we have to have a good public health system. Quick little blurb on Medicare for All. The good news about it, it's simple. It would work if the country got behind it. It would bring efficiency, which would reduce some costs, and it will eliminate cost sharing and premiums. But the risks are there's no private insurer competition, large political battle, and of course the medical industry would lead the opposition, and they have a lot of money. And so there's a bunch of different Medicare for All plans. I'm not going to go through them for you guys, but they call it all Medicare for All because that just sounds popular. So what is real reform? You know, basically, we need to fix underlying cost of healthcare and decide how we're going to one system to pay for it. And I love Franklin Roosevelt's, this is my favorite statement from him, and so he's my favorite president, by the way. The country needs, unless I mistake its temper, the country demands bold, persistent experimentation. It is common sense to take a method and try it. If it fails, admit it and try another, but try something. And so that's the problem to me with politics right now, is that people want a definitive answer, and if you make one mistake, you know, you're bad. And so we need to be able to talk about how to fix things, and instead of just trashing things if they're not working, figure out how to fix it. And so to me right now, the best way we need to go is to fix the ACA. So I'll stop there. I'll quit sharing my screen so that I can see everybody. Questions?
Carolyn, if you can give us a top side, but listening to this longer version of the presentation, you addressed the way we do billing for insurance companies and how much money we're basically wasting in the way that's done right now. Can you just give us a quick take on that?
Yep. The overhead in most other countries is 5 to 15% of healthcare costs. In our country, it's 25 to 30%, and about half of that's due to billing. And so if we had a single billing system, we would save about $400 billion a year, which would be enough money to provide primary care to everybody as a free public service.
Amazing.
Yep. And that's actually a healthcare policy. So I worked in healthcare policy for politicians, and that's a big proposal I've been pushing for about 10 years, is to provide primary care for all as a public service. And if you guys ever want to hear about that, I'm happy to talk about that another day.
I just have a quick question and comment. It seems to me that one of the largest impediments to reform is lobbyists, and just want to get your take on, you know, any issues around lobbying, healthcare, insurance lobbying. You know, are there lobbying groups that are actively pushing for this type of reform?
So the problem is the dollars that the drug companies, the health insurers, and the healthcare providers have is huge compared to the dollars that go to lobbying for common sense healthcare reform. So we need to fix how Congress people are. I mean, we need political campaign finance reform to actually get to good health reform without a huge fight. So did you guys learn stuff? I hope you enjoyed it.
Absolutely.
Okay, guys. Well, I think we have, what, 2 more minutes? And Kristen, thank you so much for having me. I hope this is what you were looking for.
Absolutely. Thank you so very much. I'm really excited you said yes to do this.
Yeah, it's always fun to educate people. So, you know, most people have no idea about the history and the cost and the problems. And I think if everybody took the time just to understand the big picture, we might act. And you guys, I spend 5 minutes a week minimum, more now, calling my politicians. And I can tell you, since I work for politicians, I know that they listen. And so just commit to whether you're calling a local representative or your state or federal or the White House. Commit to 5 minutes. It's easy to do. And I actually, on Twitter, I tweet a video of myself calling my representatives and just talk about one issue a week. And they do listen. They keep tabs of who's calling about what and how. And unless they're truly just in the party over constituents, they actually do listen. And sometimes you can change minds.
Excellent.
Great.
Thank you so much, Carolyn.
Okay, thank you guys. Take care. And now,
Thank
Kristen,
you
I'll
very
send you
much.
these as soon as we hang up.